Kegel exercises, also known as pelvic floor exercises, are beneficial for females as they help strengthen the pelvic floor muscles. Here's how to perform them. 1. Find the right muscles. To locate your pelvic floor muscles, try to stop the flow of urine while you're urinating. The muscles you use to do this are the ones you want to target with Kegel exercises. However, do not make a habit of stopping urination midstream, as it can lead to bladder issues. 2. Isolate the muscles. Once you've identified the pelvic floor muscles, sit, stand, or lie down comfortably. Squeeze these muscles as if you're trying to hold in gas or stop the flow of urine. You should feel a tightening or lifting sensation in your pelvic area. 3. Hold and release. Hold the contraction for a count of 3 to 5 seconds, then relax for the same duration. Repeat this process for 10 to 15 repetitions. 4. Set a routine. Aim to do Kegel exercises several times a day, gradually increasing the duration and number of repetitions as your muscles become stronger. Kegel exercises can help improve urinary incontinence, enhance sexual function, and provide better support to the pelvic organs, particularly after pregnancy and childbirth. If you have any concerns or questions about Kegel exercises, it's advisable to consult with a healthcare provider for guidance tailored to your specific needs.